And welcome to another edition of South Texas Crossfire. This is attorney Joe Flores reminding you to join us each and every week right here on KTMV with the Lopez family. Special thanks to Don Humberto. He passed away, but he's the patriarch, and we honor him on each and every show. And my good friend Carlos Lopez, you guessed it, the Ted Turner of South Texas Broadcasting, right here on KTMV, and Time Warner with a couple of 100,000 subscribers strong. And I want to thank our sponsors, River City Hospice and Vasquez Flores Home Health. Let's jump in feet first. We're going to be having a topic that concerns everybody, whether you have a father, sister, brother, and whether you're skinny, medium, or overweight, or short, tall. Stroke affects everybody. Heart disease affects everybody. But with us today, we've got the distinct pleasure of bringing on a neurologist, Baylor-trained, board-certified, chief resident of Miami back in the day, my good friend, and introducing him to the public, Felipe Santos. Hi, Dr. Santos. How are you?
Thank you, Joe. Thank you for having me.
Well, thank you. And let's get started feet first here. We wanted to bring you on because of the importance. A lot of people pass by Spahn Hospital and they're saying stroke center and things like that. But first, before we get into that, tell the people a little bit about yourself, your education, training, and background, and your family, where you grew up.
Sure. I'm from Laredo, Texas. I went to public high schools there, public schools. I graduated from Nixon High School. Yay, Mustangs. You know?
Mustangs, all right.
And then I went to St. Edward's University in Austin and ended up at Baylor College of Medicine in Houston, and then where I received my MD. And then I trained an internship, residency, and a fellowship in neurology and neuromuscular diseases at the University of Miami.
And so with that training came a lot of different patients. And what sort of patient populations and diseases did you treat?
Sure. So as you mentioned, Joe, I'm a neurologist. Neurologist is a field of medicine that has to do with diagnosis and treating conditions of the nervous system, being the brain, the spinal cord, the hands, the peripheral nerves, and the muscles themselves. So any condition that affects that spectrum of our body, we treat. For example, strokes you mentioned, epilepsy, seizures, peripheral neuropathy, and migraine headaches. So it's a really wide spectrum of diseases that we treat.
And where are you located? Right there on Hospital Boulevard,
My
right?
office is right in front of Memorial Hospital, 2601 Hospital Boulevard. It'll be at your service. And I've been there for 12 years.
Now, let's talk about the stroke. A lot of people out there say, well, how would I even know? Everybody's trained to left arm pain, chest pain, nausea for a heart attack.
Correct.
And they say time is muscle, but very few people are getting the education and training on stroke symptoms. Can you talk to us a little bit about that? If somebody wakes up in the morning, male, female, and stroke does not discriminate,
Sure,
right?
that's correct.
It's not just obese people or skinny people or tall or short people or men or women. It affects everyone.
That's correct, Joe. Yes, so I think that's a common misconception when I see somebody with a stroke and I talk to the family, they always have the idea that it's a heart attack, and they sometimes use the word stroke and heart attack interchangeably. But a stroke, if you will, it affects the brain, and a heart attack affects the heart. So a stroke is damage to a part of the brain because of poor circulation is the most general and the broadest definition I can think of. Of course, there's different types of strokes, but that is the most common one, where one of the small arteries or one of the large arteries in the brain plugs up with cholesterol, fat, and then there's no more circulation and people have stroke.
And so there's two different types then, the bleeding in the brain and then the embolic event or the clot.
Correct, that's correct. The clot can be what we call an embolic event or a thrombotic event, and the most common one is a thrombotic event. And you mentioned that what do stroke centers do? The stroke centers, we try to make the public aware, and thank you for having us again to do this. So one of the key features that we try to educate the public, they can remember the word FAST, which stands for face, arm, speech, and time. So if you or your loved one has any symptoms that affects their face, they become numb or tingly, or they have weakness on one side of the face or the other, that might be a sign of a stroke. So face, or numbness or tingling in the arm, or weakness in the arm. That could be a sign or symptom of a stroke. And speech, if people have difficulty expressing themselves, or not only thinking of the words but actually saying them, or they have garbled speech, if you would, that can also be a sign or symptom of a stroke. So face, arm, and speech. So FAS, and then T, it stands for time, because if you have any of those symptoms, it is very important that you go to the emergency room or any hospital as soon as possible.
And when people, if they get those symptoms and they go, and again, that's FAST, which is face, arm, and then speech, and then time.
Correct.
And the time is muscle, as in the heart attack. Brain, you're losing part of your brain if you don't hurry. Now, what can be done if they go to the hospital on time?
Correct. So we are very excited because time is brain, and the sooner people can go to the hospital after such an event, we can diagnose them and treat them appropriately. The treatment right now, if you reach the hospital, reach the emergency room within 3 hours, the sooner the better, of course. There's lots of studies to show that we can help people up to 3 hours, but the sooner they get there, the more brain is saved. So there is treatment available for a stroke, and to limit the symptoms of a stroke, to limit the complications or the deficits or the weakness that can occur after a stroke. And that treatment is intravenous therapy available in the emergency rooms.
Sort of like a clot buster that you would give for the heart that would dissolve the clot, if you will?
That's exactly correct. That's exactly, there's different brand names, but overall they do the same. They are clot busters, if you would. They dissolve the clots that are blocking the artery. So people, sometimes miraculously, they will come in very weak or sometimes even comatose, and we'll give them the clot buster, and they'll wake up, or their arm strength will improve dramatically. It's rarely that people wake up from a coma with that clot buster, but that's called the Lazarus effect, if you would, because it's very, very dramatic when people can get there in time and we can help them. Now, that doesn't happen all the time, but it's the best chance that people have to recover if they do have a stroke, to get there to the hospital fast.
How common are strokes in the United States?
Strokes are probably very common, especially now that obesity epidemic is going up. The risk factors for stroke are obesity, age more than anything really, because young people don't have strokes, but age, the changes that happen in the arteries as we get older occur with age. The risk factors that make those changes worse are high cholesterol, diabetes, high blood pressure, and smoking is also one of them.
Sounds like half the population here in South Texas. I'm glad you're on.
Yeah, that is lots of people here in South Texas, and again, thank you for having us, because
sounds like a barbecue at everybody's house, right? Stroke, knock on wood, but try to do something about it. But smoking, even in thin people, smoking is such a high risk factor. It almost rivals obesity.
Correct.
Or it does.
Correct. No, correct. That's true. The smoking, it's bad for everything in your body. So we greatly encourage people to go to the doctor, get some treatment to discontinue smoking when they're smoking.
In fact, I still see patients as a nurse practitioner. I went by and saw a person, unnamed, of course, whose spouse was a heavy smoker, and trying to use that kind of electronic cigarette or what have you that has about 1/16 of the nicotine. And it really has helped in lowering the amount of smoking. So even cutting down smoking helps.
That's correct. And we have to remind people that smoking not only affects the smoker, but their family around them. So parents, if you want to keep smoking, you can do it away from your kids.
And, for the obesity epidemic and everything, those of us who are overweight, even walking helps. What other measures can help to decrease? Would you recommend aspirin for people to take to decrease smoking? To decrease the risk of stroke?
So exercise is one of the best therapeutic interventions that we can do and the person can do for themselves. Just exercising reduces the risk for heart attack, stroke, makes you lose weight. So exercise as much as possible, and always get it with a professional if you're going to start exercising, to put you on a low regimen to build up rather than start doing everything hard right away. So always get with a professional so they can teach you how to start exercising.
Well, and we talked about the lifestyle modification. There's one other factor that we know that you're also certified in sleep medicine. And so stroke, having sleep apnea, and we'll talk about that in the second half of the program.
Correct.
Is also a precursor or a risk for stroke, correct?
Correct. So obesity and sleep apnea generally go in hand, not 100%, but generally.
Roncando.com, perhaps?
Yes,
yeah.
Snoring, correct. So
Right.
everybody who snores has a great chance of having sleep apnea. Sleep apnea has been associated with worsening people's diabetes, worsening people's heart problems, and also worsening their high blood pressure. And sleep apnea in itself is a risk for stroke. So if you treat yourself, if you see your doctor and he recommends a sleep study or an evaluation for sleep apnea, be sure to take advantage of that, because that being treated for sleep apnea, if you do suffer from it, can help many aspects of your health.
Well, I appreciate that, and we're having some very important information. Board certified neurologist, Baylor trained, Dr. Felipe Santos here with us, talking about stroke and other neurological injuries or problems that can affect all of us here in South Texas. We're going to take a brief break. When we come back, we'll be talking more about the silent killer, sleep apnea, and also about stroke when we come back.
Call River City Hospice for your loved one's care today. River City Hospice is a compassionate, patient-centered healthcare provider with a unique approach to medical care and support for people at the end of life and their families. River City Hospice focuses on maintaining dignity, increasing quality of life, and providing comfort and reducing pain due to illness. Hospice care allows your loved one to be treated with dignity and respect and gives them the right to choose. Call 882-5900 today. Hope, dignity, and love. It's got to be River City Hospice.
Hi, this is attorney and board certified nurse practitioner Joe Flores on behalf of Vasquez Flores Home Health. Nursing homes have their place, but having care in your own home is very important. Call today for more information. Backed by over 20 years of experience, registered nurse Priscilla Vasquez can answer your questions about home care. Call 881-9922. That's 881-9922 today. And we're back after a brief break. You're watching South Texas Crossfire with your host, attorney Joe Flores. And don't forget our sponsors, River City Hospice. Hope, dignity, and love. It's got to be hospice. If you have a loved one with severe heart, lung, kidney disease, or cancer, give them a call. It's not what you think. See what benefits there are to offer. You never know. And also, if your loved one has lost a lot of weight, you can call them. Adult failure to thrive and all these other diagnoses can be helped. River City Hospice, 882-5900, and Vasquez Flores Home Health, 881-9922. Backed by over 20 years of experience, Priscilla Vasquez can help you start an exciting career or help your loved one stay at home. Nursing homes have their place, but we need to have as much autonomy as I can for our loved ones. Now, back to our guest. Everybody gather around the sofa. We have got a special guest here, board certified, Baylor trained neurologist, Felipe Santos. Welcome back.
Thank you.
We were talking about stroke and we were talking about FAST, which is if you have tingling of the face or other drooping of the face, if your arm is affected or you can't move your arm, if your speech is garbled or affected or you can't get the words out, and the timing, you have less than 3 hours to get to the ER, so anything can be done. So you call that FAST.
Correct.
Okay, and we'll be putting that up on your screen and also Dr. Santos' contact information. And you are at 2601 Hospital Boulevard. People there and you accept patients that may have high risk for stroke and things. Let's talk about, we left off on sleep apnea. What is sleep apnea?
Sleep apnea is a condition that's caused by, before I explain what it is, let me say that it presents as snoring. and it's snoring at night. And the apnea part means that people stop breathing, and they stop moving air into their lungs.
Almost gasping.
Gasping, correct. And a lot of spouses, when I see them in the office, the spouse of the patient will bring them in because they thought they were dying in their sleep because they're gasping for air. There usually comes a series of snores and then a big loud snore where they actually wake up. And people sometimes
And wake up the whole neighborhood.
wake up the whole neighborhood, correct. So that's what sleep apnea looks like on a nightly basis in people's homes. It occurs because as we're sleeping, the muscles in the back of our throat become very relaxed, and also there's obesity and there's more fat tissue in the back of the throat, and the muscles become relaxed. The throat collapses, and no air can pass, and the noise that you're hearing is the forceful expiration of the air, and or inspiration of the air. And the apnea part is when it completely closes, and when it completely closes, your heart rate goes up. You excessively, like you say, you feel like you're choking, you feel like you're gasping for air, and then you wake up.
And that's why you never feel like you're rested in the morning.
That's correct.
Because you've been fighting all night trying to sleep.
That's correct. That's correct. So all of us need soundful sleep. There's several stages of sleep that we have to go through, and if we don't comfortably go through those stages, even though we're in bed and snoring, we're not getting soundful, restful sleep, and we wake up with feeling not rested, feeling still tired, and consequently, people have what we call excessive daytime somnolence, and that affects their work, affects their life, puts them at danger for car accidents and those kind of things.
Like shift work disorder, excessive sleepiness.
That's
Now, some people say, well, I'm not obese. Maybe I snore some, but positionally I can change. I've seen some people wear a T-shirt at night with a pocket with a tennis ball in the back, and they don't sleep on their back. Some people sleeping on their back may snore, and then maybe this apnea could go away with changing in position?
Correct. So that's probably the most common type of apnea, people sleeping on their back because they have, in the back of the throat, they have more tissue or they have big tonsils. And that's a common technique that people do themselves, sleeping on their side. And they find all kinds of creative ways to achieve that. Tennis ball and their shirt is one of the ones that people do that.
And now, if it is too severe, though, you recommend a sleep study and a mask that you wear.
That's correct.
And they've gone pretty far with the masks, where you can wear a mask that will. What does the mask do?
So the mask.
And I think everybody's seen it. You look like you've shot down a few bogeys on Top Gun. You've got the mask right here.
Correct.
And what does it do?
So the sleep study is the diagnostic part. We cannot by insurance company rules and Medicare rules, we cannot just prescribe the mask without documenting first that the people do indeed have sleep apnea. And that's achieved by doing a sleep study. And what that involves is the patient comes into the sleep lab where their breathing is measured, their sleep is measured, their heart rate, their movements of the extremities, and all those factors are measured, and so we can show that they do have sleep apnea. Once that is achieved, then we also, sometimes the same night, sometimes the following night, we put them on the mask. It's called CPAP. CPAP is the most common one. CPAP stands for continuous positive airway pressure, meaning that the mask, what it does is continually pushing air into your lungs, and specifically to the back of your throat, so they can stay open. Remember, we talked about the throat collapses or the back of the airway collapses, and so this mask prevents that from happening.
Okay, and so essentially the mask doesn't make a lot of noise, better than the snoring.
Correct. Right.
And what it'll do is keep your airway open, and what happens then? Your blood pressure, heart rate, and your risk for stroke actually will go down.
That's correct, and there's lots of studies, a lot of medical studies to show that diabetes glucose control improves, the sugar gets better, the blood pressure gets better. People who have a condition called atrial fibrillation or very fast heart rate, that improves to some degree. So there's lots of benefits other than just feeling a lot better in the daytime. You're not running around sleepy and making mistakes and putting your risk or your coworkers at risk, putting your family or coworkers at risk because you're so sleepy. You're feeling a lot better if you follow the treatment.
And transitioning to that, neurology and neurological medicine, I know you'd brought this up during the break. A lot of people suffer from pain because of diabetes, or worse yet, they can't feel their extremities like their feet, and they end up losing their feet, their toes, and things like that. Tell us a little bit about what's called neuropathy,
Sure.
and what the pathophysiological, fancy word for how it starts and what's happening in your body.
Correct. So we started talking about what neurologists do. So we talked about problems with stroke, which involves the brain, and neurologists cover the other end of their body too, the feet. The feet, as you know, anywhere in the body there's nerves. Peripheral neuropathy is one of the complications of diabetes, poorly controlled diabetes, and the other ones, are eye problems, kidney problems, but neuropathy is one of the more common ones. Neuropathy is damage to it can be the small nerves or the large nerves, and eventually ends up being both nerves. But there's the neuropathy presents, or the people's symptoms are pain and tingling, generally at the bottom of the feet. Starts with the bottom of the feet and then progresses to the top of the feet, and then the ankles, and then the legs. And it initially is quite painful, but there's treatment for that, there's medical treatment for that. But eventually it becomes to the point where the nerves are so damaged that the patient's feeling is all lost, and they're not aware of where their feet are, or when they step on a nail, or when they cut themselves, they're not aware of those problems. And consequently, they are at risk to develop infections. So on top of being numb, most people with diabetes and high blood pressure also suffer from poor circulation. So if you have diabetes and have a cut to your foot, and you don't feel it and you let it go, it can become infected. And then because of the poor circulation, the infection is very, very hard to cure.
So what's some of the medications and treatments that you can do for peripheral neuropathy that can help, especially in the diabetic?
So the best thing for the diabetic is, once they have peripheral neuropathies, follow closely with a doctor. And it doesn't have to be a neurologist, of course. It can be the family doctor, it can be an internist, anybody who can manage their glucose so they can maintain it as normal as possible. That's the most important thing, because that's what's going to keep it from getting worse. Having done that, then if there's still pain, we can always treat pain medications, and we neurologists generally use non-addicting, non-sedating pain medications that work specifically on the nerves, rather than giving pain medications like Lortab and morphine. We try not to use those medications. We use more specific medicines that work on the individual nerves in the feet.
The other issue that we're talking about is, I know a lot of people are very stressed out about, is how the Affordable Care Act is going to affect them, how it's going to affect diabetes in here, how it'll affect getting treated. A lot of people are afraid to go to the doctor because they're afraid they won't have the insurance or be able to afford it. Is there a place that people that are, we know for the very poor there's treatment, for the rich or the well-off that can afford insurance, there's treatment, but what about the people in between that are uninsured, or that are going to be forced or fined to be insured? Where can they get help to get treatment or get evaluated?
To my knowledge, there are several places in town. Unfortunately, what happens is most people end up receiving their medical care in the emergency room, and that's probably not a good choice unless it's a true emergency. But there, here in Corpus Christi, there's the Nurses County Clinic, and I believe there's another clinic on Brownlee that works with people without insurance, but charges them on a prorated scale or something to that effect.
I believe Dr. Cleaves also used to have a men's clinic or something that would help people that were underprivileged.
Correct.
The other issue that I wanted to cover very quickly, we've got a couple of minutes left, is in your particular chosen field, how would you say the prevention? How many people have you seen and said, if they had just done this, this, and that, if you had to rate it in percentage, what percentage would you put on if people had just done some preventative things, they would not have had the stroke? What would you rate it at?
I think I think that's a good question. I think that besides age, we talked about the risk factors for age and what we can do. So besides aging, all the other risk factors can be attended to.
Padlocking Joe Flores' refrigerator, and then
So losing weight,
yes,
exercising, controlling your high blood pressure, whether it's by eating less salt or going to see your doctor to give you medications, controlling your diabetes. So yeah, all those things, all the risk factors except for age.
eating at low-fat taquerias,
Right.
right? Now,
So-
if they invent one of those, they're going to make a lot of money. But,
So besides age, all the risk factors can be addressed, and smoking, of course, is probably
Smoking.
the major. Smoking is.
I think that we've addressed smoking so much so, great campaigns in the last 20 years. What would you like to see as a marketing campaign or a public service announcement campaign that we could have as far as getting out the message on stroke prevention? What would you like to see happen?
Well, I think the medical aspect of it is already in place. You know, most hospitals, if not all hospitals here in town, can administer this medication we talked about. So now, and thanks to programs like yours, we're making the public aware that, again, we'll repeat, fast, face, arm, speech, and time. If they have any of those symptoms, they can please go to the emergency room so we can take care of it. So, so public awareness campaigns, again, thanks to you, and other programs, making the public aware is probably one of the major things that next needs to be done.
Anything, final words, last minute that we have that you'd like to tell the public about anything at all?
Yeah.
As far as medicine and things.
Well, you know, this is. I was thinking while you were introducing your sponsors. As a physician, we prescribe or use hospice care, but on a personal level, I was not aware of the importance that hospice care provides until a very close friend of mine went through a severe and fortunately finally terminal event with lung cancer. And I can tell you from personal observation, visiting him in the hospital and helping him in the hospital, and then seeing him at home, he became most peaceful and pain-free when he finally, when his doctor finally was able to prescribe hospice care for him. That transition with the attendance of his wife and other healthcare members, this last several days of his life were dignified, were pain-free in his home environment, and I was really impressed with that part.
Well, I appreciate that. In fact, one of our sponsors, River City Hospice, does that. And I was not a big proponent of hospice until my father became ill. You, of course, took care of him, and we always thank you for that. And he passed away as he lived with a lot of dignity. And if he had to have that, he inevitably would have wanted hospice too, because I think that a lot of people nowadays want control over the end of their lives or the last of their lives, as they've had throughout their life. And I think that a lot of people say, I don't want to die in a hospital, and I don't want the indignity. I think we want to do that. But again, Felipe Santos, board certified neurologist right here in town, 2601 Hospital Boulevard. We were talking about stroke, and remember, fast, face, arm, speech, and time. Once again, this is Joe Flores, your host, South Texas Crossfire, signing off. Thank you all, and God bless.